In this presentation, I will explain what a cerebral aneurysm is, common symptoms, treatments, and ways to prevent it. A cerebral aneurysm occurs in a brain artery. The artery bulges out as it fills with blood, resembling a balloon. They can occur anywhere in the brain, but most form at the base of the skull where major arteries are located. While aneurysms themselves aren't contagious, some aneurysms, such as myocardic aneurysms, are developed from an infection that weaken artery walls. Smaller aneurysms are difficult to identify because they rarely cause symptoms. Once an aneurysm has reached a larger size, they can cause headaches, difficulty concentrating, problems with short-term memory, difficulty speaking, loss of balance, visual disturbances such as loss of vision and double vision, numbness on one side of the face, and pain above or around the eye. Once an aneurysm has ruptured, it can cause seizures, loss of consciousness, or cardiac arrest. And then prior to a complete rupture, some aneurysms may leak, so this can cause very sudden and severe headaches. There are a couple of people that are very susceptible to aneurysms, including people over the age of 40, women, people with an immediate family member who has suffered an aneurysm, and people with high blood pressure. And people with high blood pressure, a lot of those people include people of Hispanic or Black backgrounds, which makes them also more susceptible to having aneurysms. Although there is not a known cause for the development of aneurysms, some people may develop an aneurysm due to genetics that have caused weakness in blood vessel walls, head trauma, meaning there was a large impact to the head, or an infection that targets or weakens their blood vessels. People have a higher risk of developing an aneurysm if they leave their high blood pressure unattended, if they smoke, abuse cocaine or alcohol, or leave their current aneurysm untreated, which can lead to it bursting and becoming a hemorrhage, which could lead to sudden death. To reduce the risk of developing an aneurysm, a person should treat their high blood pressure, avoid smoking or abusing drugs or alcohol, and getting screened if there is a history of aneurysms in their family. There are currently a few treatment options available for cerebral aneurysms. If the risk of the aneurysm rupturing is considered low, the patient will be put under active observation, meaning that they will receive regular checkups to ensure that the aneurysm doesn't rupture. If the patient is at higher risk of having their aneurysm rupture, 2 different surgeries will be considered. The first surgery is called neurosurgical clipping, which is an open brain surgery. In this procedure, the surgeon clips the artery that the aneurysm is formed on to prevent any further blood flow. The second surgery considered is endovascular coiling. In this procedure, a coil is threaded throughout the body up to the brain, blocking blood flow to the aneurysm. Both surgeries are semi-effective and can cause possible damage to other blood vessels, brain damage, and can increase a patient's risk of having a stroke. These treatments can also be used to treat a ruptured aneurysm. That said, less than 30% of patients' brains return to a pre-ruptured state. To end this off, here are a couple more facts about aneurysms. 6.8 million people in the United States, that's 1 in every 50 people, have an unruptured brain aneurysm. 50% of people die after their aneurysm has ruptured. 50% of ER admissions for severe headaches are due to a ruptured brain aneurysm. Most aneurysms are around 1/8 of an inch, which is the height of 2 stacked quarters, and September is known as Brain Aneurysm Awareness Month.